Welcome to another segment of our Mental Health Moments. My name is Linda Golick. I'm the Health and Wellbeing Consultant at Bellin Health. And I am so pleased to have two special guests today on our segment. So, first of all, our behavioral health therapist, Hannah Bauer. Hannah, how are you?
I'm good. How are you?
I'm good. I'm good. Thanks for being here.
Yeah.
And then also today we have Melissa Viste. Melissa is actually a community health worker out in our Wrightstown district. So, welcome, Melissa.
Thank you.
Melissa, I just wanted to start with you. So today we are really going to focus on the mental health of children. Really important topic, and gets a lot of interest from our viewers and from our patients, at Bellin. So we really just want to provide some education, some additional information on caring for children. So Melissa, I just want to start with you so that people know a little bit more about your role with Bellin. Can you tell us a little bit more about what it means to be a community healthcare worker and maybe what your days kind of look like?
Yeah, absolutely. Well, thanks again for having me. And so, like Linda said, I'm a community health worker in a school setting. So I'm a school-based community health worker. And my primary goal is to address social determinants of health. So helping people who are maybe facing food insecurity, maybe have needs around housing, transportation. And then another big area that I support families with is healthcare system navigation. So that sort of feeds into the mental health piece quite often because I do find that that system of accessing care can be complicated for families and there's barriers that they face. So my role is to come alongside them and help them figure out how to overcome those barriers and figure out what we can do to get their children the support that they're looking for.
Awesome. That's great. So interested to hear more on the connection of what you've seen in your experience there too. Well, Hannah, if we could start with the idea of, I think it's important for us to just kind of base our conversation in the idea of how is children's mental health different from an adult? How do those
Sure.
two things different?
Yeah. So one of the biggest differences is they don't know how to talk about how they're feeling, right? So an adult has so many words to be able to express how they're feeling, what they need. They have so many abilities to be able to go and get help, to go and use a variety of coping skills, to just go and take a break. Whereas kids, like they're on a pretty rigid schedule. They're in school for 8 hours a day. They maybe don't know how to ask for help. They don't know how to say, like, this is what's going on, like in my body or in my head, and I need a break. And even if they can, they may not necessarily be able to get it. Right. So, what we're really going to see is behaviors. You're going to see acting out just because kids are not able to ask for the same things in the same way that adults can. So, it looks wildly different and it's treated very different than, adults that may be facing things that might be quite similar on paper, but it looks different in like real life application.
So would you say, Hannah, one of the things to maybe watch out for, if a child is in need of some additional assistance in that way, is a sign might be that they are a child that acts out? And then how do we know the
Yeah.
difference between like a kid that's having a bad day and being kind of stubborn and a kid
Mhm.
that really may need some additional assistance?
Sure. I think the difference would probably be in the persistence. And I think also in it's really important to just take that time, right? So, regardless of I guess, how long that you're seeing the acting out, just taking that time to see what really is going on because whatever that behavior is communication. Right. So when we see this behavior, that is a kid trying to communicate with us that there is something going on, whether it's at home, whether it's at school, whatever it may be. There's something going on that's not agreeing with them that they can't fix themselves and they need help. So just taking that extra time to talk with them, if that's something that you can fix in one sitting and they feel better about that, that's great. But if it's not, and it's something that you feel like, okay, this is way beyond something that I can fix right now, or this is something that you're like, okay, I can fix this, but I know that this is going to be something that they're going to struggle with for a while, or they're going to need some additional support dealing with, then I would say let's make some connections here so that they have the support that they need to deal with something like this. And I think it's always helpful, more often than not, to just give them that additional support. There's no rule that says therapy has to be forever.
Mhm.
Sometimes I see kids for, 2 or 3 sessions, and, like, that's all it takes, especially when it comes to kids. Like, a lot of what I do is it's modeling for parents. It's teaching them how to ask them certain questions. There's a lot of fear that comes with mental health. A lot of people don't want to ask, "Hey, are you having thoughts of hurting yourself? Are you having thoughts of just not wanting to be around?" You know, but you have to, because kids have those thoughts too sometimes. So a lot of mental health, especially with little kids and including parents in that, is just you need to be able to ask those questions. You need to be asking them in a way that it's not scary, in a way that kids aren't going to be afraid to talk to you about that and they feel supported and they feel safe. And then, if you can do that in a couple sessions, great. Right? Then the family feels safe enough to do that and support their child. And then the kid feels safe to go home and feel like whatever is going on, they can talk about it with whatever adult is in their life to support them. Yeah.
Awesome. Awesome. So, Melissa, let's talk about your work then and how it kind of bridges to that. Because I think I see some of your work as connecting people to the resources and that potentially becoming a pathway to helping them improve potentially their mental health. So, do you want to tell us some examples of that or some stories that you have that really bridge what you do to helping somebody in terms of their mental health?
Yeah, for sure. So, I mean, some of the barriers that I think some of our parents face, first and foremost, unfortunately, is insurance and just the financial impact sometimes of accessing mental health care. So, again, just helping navigate barriers with providers and their insurance. Sometimes I think folks are um, discouraged by wait list. If they have to wait a certain period of time to access a provider, that can feel discouraging. And so again, just looking for other providers that might have a shorter wait, but maybe are a longer drive. So just kind of balancing what the need is and where they're at in terms of what they feel like they can accommodate. Another barrier I think for parents too is just the timing that sometimes the appointments take. They may be able to get off of work for a dental appointment twice a year or an annual checkup, but if
Mhm.
if they have ongoing therapy appointments every other week, that can be a stretch for some families to take off work. And unfortunately, one thing that I found is that a lot of families don't have the social support network that
Mm.
perhaps generations past have had, or
Mhm.
just for a variety of reasons. So, they may not have a grandma that could take Joey to an
Mhm.
appointment. And so that piece can be challenging. And one way that schools have been able to sort of help mitigate that piece is through the school-based mental health program. So I know Bellin has partnered with some schools, and Wrightstown has partnered with a clinic as well to provide on-site therapy services, so that they can incorporate that during the school day and the parent doesn't have to take off work or make time for another appointment, essentially. So, but that being said, that approach doesn't always fit all of our students, and some students aren't comfortable
Mhm.
with that. They would prefer to have an outside provider
Mm.
that isn't related or attached to school at all. So, and then some kids, just as Hannah mentioned, it can be treatment can look very different for some kids. So they may not be comfortable doing sort of a talk therapy type session. So maybe they would feel more comfortable doing art therapy or animal assisted therapy, and just really meeting kids and families where they're at with what their needs are and what they're comfortable with. So I help, locate some of those unique types of providers that can really support them. Um, and I think, just again, coming from a school perspective, even just helping parents make that initial bridge or leap to the school counselor is a good first step. I have been able to work on several different initiatives in the community, and one of them is Laundry Love. And so, because again, social determinants helping people with basic needs. So laundry
Mm.
is something that we're working on, and I have a great base of volunteers from the community. But one of the volunteers as a parent of an elementary student, and she mentioned I asked if she was able to volunteer, and she said, my husband's out of town at work, and I just can't because my daughter has meltdowns pretty much every day after school. Like she's
Mm,
totally good during the whole school day, but she comes home and she's so
Mhm.
dysregulated and needs her there to support her. And so, but that was the first time I think she's told anybody about that. And so I was able to suggest to her, maybe I bet the school counselor has no idea that she's having some struggles.
mm.
Right.
Let's connect and see, if there's ideas or things she could help with. Or maybe there is something at school that they could support her with so that she's feeling less dysregulated when she comes home. So I think getting
Right.
those conversations going, knowing parents have someone to talk to and just brainstorm with, judgment-free zone, just where, meeting
Mhm.
them wherever they're at. So yeah.
Yeah, and it's been so helpful, like, having you because, like, just, like, being able to coordinate with you or, like, get somebody in, quicker than a wait list would be, or even just getting, like, background information so that I'm maybe a little bit more prepared before I meet with somebody, that's really helpful. And then too, like, just also, like, just out in the community, like, everything that you've done is really helpful because there's a lot less of a barrier now too, because people are much more willing to seek help. They're much more willing to make that phone call because it feels much less threatening. So it's nice, just having that bridge there because it makes such a huge difference.
Yeah, good. Well, and I think some of that side by side stuff, like you said, bridging,
Yeah.
has been something people have needed. Just even
Mhm.
I've worked with some single dads who have wanted to get their kids connected to therapy,
Yeah.
but the paperwork piece feels overwhelming to them. And so,
Mhm.
I've flexed my schedule, and after they get done with work, they'll come to my office, and we'll spend
Sure.
2 hours doing paperwork, and
Yeah.
Mm.
which isn't fun for anyone, but at least they don't feel like they're alone, right? And at least
Yes.
they have a scheduled time to just get it done, and
Yes.
then their kids can move forward with some
Mhm.
support. So,
Yeah.
I've sat and made phone calls with people, talked to their insurance alongside them.
Sure.
So I think just not feeling alone in it can be really
Mhm.
helpful for parents. Yeah.
Yeah.
Yeah, one of the things that I've really just noticed and just kind of reflected on is that it's just a different world today,
Mhm.
and kids are just dealing with different issues that maybe we didn't deal with when
Yes.
we were kids. And it's
Yeah.
just different. Do you see that too, Hannah?
Yes, and that's a lot of the conversations that, like, I find myself having because there's such a disconnect and parents are like, "Well, I didn't do this when I was a kid, and so my expectations are this, this, and this, and I don't understand." And it's like, well, the world is very different, number one, and, like, kids are learning and they're doing everything for the very first time. So you cannot really have these preconceived expectations that they're just going to do what you want them to do because they don't know what they're doing. Like their job is to make mistakes. Their job is to do all of these things wrong because they are literally learning everything for the first time. And so it's overwhelming. It's overwhelming for everybody. And parents have to take that step back and take those deep breaths and recognize like they're not going to know what they're doing because the world is different and neither are their kids. So everyone's learning at the same time and it's stressful and it's hard and it's messy and that's okay. That doesn't mean that anyone is doing anything wrong. It's just hard. And it's okay to ask for help and it's okay to be overwhelmed and it's okay to not know what the answer is. That's fine. We're all figuring it out. Like there's no magical answer. It's all okay.
Hannah, a lot of what Melissa is doing is she's really focusing on those social determinants of health, and she's helping people
Mhm.
bridge those gaps to fill some of those gaps in so that people can access the things they need to access. In your opinion, what kind of an impact does that have on a child's mental health when they do get resources in those areas?
Yeah, it provides stability, and it provides just that feeling that of safety, I would say. It's just a feeling that they don't have to worry about these things that they probably notice other kids don't have to worry about. And it's one of those things I was actually talking with, some other of my patients just the other day about it's that weird feeling that you don't realize certain things are not normal until you start talking with your friends and you're like, "Oh, I was worried about, what clothes I was going to wear today." And then your friends aren't sharing in that conversation and then you're like, "Oh, not everyone is sharing in this with me." So like by bridging that gap, like they don't have to worry about that. And it's common, it's things that they can just talk about and they can feel like, "Well, I'm part of this," and the community can share in this and it just makes things better. It just makes them part of the conversation, and it makes everybody want to be part of something. And it destigmatizes a lot. And I think, everyone benefits from that,
Mhm.
obviously. Yeah.
Yeah. So one thing that I heard just recently from a coworker of mine, she has like an 8 or 9 year old, and then she has a baby. And one of the things that she has always said to her 8 or 9 year old is, "You're safe, you're cared for, you're loved." And the other day, she heard the 8 or 9 year old telling the baby that, "You're
Aw.
safe, you're cared for, you're loved," and that really struck me. Um, but like from both of you, I would love to hear your opinion on what does that mean to you for a child to be safe and cared for and loved? What does that mean to you? I'll start with you,
Hmm,
Hannah.
okay. Interesting. I guess I don't
Yeah,
know. It,
good
it mean, could
question,
mean
right?
it means, yeah, it means a lot of different things. I think I think it's the lack of having to question. I think it's the lack of having to question, like, what's going to happen next. I think it's the lack of having to question, like, who's going to be there, because you feel like, okay, well, someone's going to be there, and it's someone that I trust. It's someone that I feel safe around. And if I do have questions, someone will be there to answer them. And like, same with feeling loved. There's no question, right? I can make a mistake. I know that people are still gonna want me. People are still gonna wanna be around me. They're gonna love me even if I do something wrong. I think it's the lack of having to question what will happen if I do X, Y, or Z, or if something changes in my life, will I still be okay? That's kind of,
Good.
yeah.
Yeah. How about
Your
you,
turn.
Melissa?
Yeah, I mean, I would sort of link it back to what Hannah was saying in your question earlier about how addressing those social determinants really impacts families. And I mean, the school is very, I think, interested in the benefits of it because it helps kids learn, right? When they know that
Mhm.
they have a safe place to go home at the end of the night, that their housing is stable, that they have food in their home, those things, taking those things off their plate and out of their mind means they can focus on learning. But I think it also, for the parents, when you take those things off their plate and they're not worried about being evicted, they're not
Mhm,
worried about having food for their family and being able to provide, it means they get to show up more for their kids. It means they get
mhm.
to have that emotional capacity to invest in their kids, to sit with them and watch Bluey and and tell them they're loved and cuddle with them at the end of the
Yeah.
night
Yeah,
versus
and be
trying to go
present.
through their bills again and see how close they are at the end of the month. And so I
Mhm,
think just being able to support people with those basic needs really brings a lot of peace to homes and helps
mhm,
parents be the
Mhm.
parents they want to be. Because, every parent I've met, no question, they love their kids.
mhm,
100% they
Mhm.
love their children. But to help them have the capacity to make sure their kids are safe, have safe, secure housing, and have that stability of, yeah, being able to access clothing and laundry and, all the things that they need to be able to be kids. Like it's really
mhm.
I think all connected.
Yeah. I would agree because if it's less for people, if you take away some of the reasons that people are stressed,
Mhm.
now, you're lightening those things off of their
Yeah.
shoulders. They're more able to be present in their everyday
Yeah.
life with their children for other things they
Mhm.
have going on. I totally
Yeah.
agree.
I think
Totally
the other
agree.
piece too around mental health is just that piece for adults too, because I've worked with a lot of parents who have struggles with their own mental health, addictions, previous trauma, and so when you're struggling with those pieces in your own life, it's hard to provide that stability to your children.
Yeah.
So I think getting parents connected to mental health resources, addictions resources, things like that, just not only models for kids what it's like to be
Mhm.
able to have the courage to reach out and get that support, and show them that it's okay, but then also hopefully provide that stability to the parent so that they can then care for their children better. So,
Yeah,
Yeah, and that's a
definitely.
piece I try to touch on too. You can't take care of your kids if you're not taking care of yourself.
Yeah.
And a lot of parents feel guilty taking that time to actually take care of themselves, to take their medication, to take a second to rest or to just take a break. But that's so important because if you're not able to take care of yourself, how are you supposed to pick up on those signs that maybe your kid is having a bad day? Because everything happens so fast that, it's so easy to miss those things. So it's really important, yeah, to focus on also taking care of yourself if you want to be able to take care of your family and your kids.
Definitely.
Yeah.
Definitely. Well, I really appreciate both of you being here with me today. I just want to give you an opportunity to share anything else that you were thinking about, anything else that you would like our audience to know, any other Bellin resources that you can mention that they could look up if they are seeking additional assistance, just anything else you want to share today. Hannah, anything else?
I don't think so for me. Yeah.
Um,
Okay.
I I think I would just highlight the case managers within Bellin.
Mhm.
I've been able to partner with
Yeah.
them to access different resources for families in the community, and they are a rock star team. They have a
Yeah.
wealth of knowledge and resources and are really great. And I don't know if people necessarily know they exist all the time.
Yeah.
So, if someone is looking to access some more resources and has a connection to a Bellin provider, then that could be a way to connect with them is through the provider. So,
Hmm.
And what's neat about the case managers too is it's specific to different counties too. So they can look at what county you're
Yes.
in and they can say, oh, this is what's available in your county.
Yes.
So we're not just talking about the Green Bay area, but we're talking about all
Hmm.
of the Bellin regions that we have people that really know what's going on specifically in those counties that can be of assistance. So
Yes.
awesome. Well, I really appreciate both of you taking the time and being with us today and just sharing your thoughts and your work with us, just trying to again bridge families and children to the best care and the best resources that we have available. It's such important work, such important work. So I thank both of you for doing that and for sharing a little bit of your worlds with us today. And for our audience, thank you for being with us. Please like, subscribe, and share this podcast. And we'll see you next time.